What is it? Post-operative pain assessment and management contributes to a large portion of care for a post-operative patient. Post-operative pain management is not a specific regime and is rather tailored to each individual patient and their individual needs. However, overall it requires nurses and other healthcare workers to assess pain and use a variety of pain management strategies, along with continuous monitoring of these strategies. Why is it important? Post-operative pain management is very important as it helps to increase comfort for patients alongside facilitating a quick recovery and minimizing the risk of certain complications. Whilst minimizing suffering, post-operative pain management also has many benefits, including decreasing hospital costs, assisting in early mobilization, and increasing overall patient satisfaction. Approximately 86% of patients that undergo surgery report experiences of post-operative pain ranging from moderate to severe intensity. Post-operative pain is very common and affects all ages, from neonates to the elderly. Opioid medication is an integral component of the multimodal management of post-operative pain, with the three most common IV medications consisting of morphine, hydromorphone, and fentanyl. However, there are many complications with post-operative pain medication that patients may suffer from, including nausea at 76.2%, constipation at 67.3%, and respiratory depression at 49.9%. In order for pain to be managed properly, it needs to be appropriately measured first. Therefore, a pain assessment is an important factor in the management of post-operative pain. This can be done to determine a patient's level of pain and discomfort, or to check if a previous management technique is successful. A pain assessment requires both subjective and objective cues. Certain objective cues include grimacing, wincing, increased heart rate, increased respiratory rate, or positional relief. Subjective cues include a patient verbally stating they are in pain or uncomfortable. The nurse may ask the patient questions such as type, location, and intensity of the pain. Pain assessment tools are often used to help the patient verbalize their pain level. For example, a numerical rating scale or Wong-Baker Faces pain rating scale. Both these scales allow the patient to choose their level of pain based on a number from 1 to 10 or from a facial expression. Another form of an assessment is the FLACC chart, which requires the use of objective information. It stands for face, legs, activity, cry, and consolability, and requires the nurse to rate each section based on the description supplied on the chart. It can be used for people who are unable to verbalize their pain, for example, neonates, people who struggle with language barriers, or someone with a cognitive impairment. Management of post-operative pain and suffering should incorporate both pharmacological and non-pharmacological methods of pain relief. Pharmacological intervention can include the use of opioids, non-steroidal anti-inflammatory drugs, and local anesthetics. Multimodal analgesic use is one of the most common ways of treating post-operative pain. This refers to the use of a combination of different types of analgesia with different actions. By using this method, lower doses of each opioid medication is required, therefore reducing the risk of certain side effects such as respiratory and cough depression. Another form of pain management includes a PCA device. PCA stands for patient-controlled analgesia and has been known to have greater patient satisfaction over PRN analgesia given as needed. However, PCAs lead to greater opioid consumption and also cannot be used by every patient, for example, someone who is cognitively impaired. Nurses can also help manage post-operative pain by giving pain medication before scheduled procedures such as physiotherapy, a dressing change, or shower. There is also evidence that non-pharmacological methods are effective in managing post-operative pain. An important non-pharmacological management includes psychological intervention, which helps to distract the patient from pain, usually low levels. For example, listening to music or reading a book can help keep the patient's mind off pain. Other non-pharmacological methods include helping to provide a stable and calm environment. This helps to lower patients' anxiety levels. Nurses can also try to promote comfort and remove sources of discomfort by ensuring the patient doesn't have a full bladder, is in a comfortable position, and can help move the patient regularly to avoid pressure sores. The negative effects and consequences of uncontrolled pain emphasizes the need for good pain assessment and management post-operation in hospitals. Pain has many effects on patients and can increase both morbidity and mortality. If pain is not controlled, patients may try to limit any movement or coughing, as this can exacerbate the pain. Little to no movement results in poor circulation, which can lead to deep vein thrombosis. The suppression of coughing can lead to a secretion buildup in the pulmonary system, which can cause pneumonia and increase the patient's hospital stay and can even be life-threatening. Non-compliance to early mobilization also ultimately leads to a slower recovery and longer hospital stay. Another consequence of uncontrolled pain is an activation of the sympathetic nervous system. This in turn leads to high blood pressure and an altered cardiac output. Overall, uncontrolled pain creates a large stress chain reaction for the body and affects other organ systems. There are many barriers to effective pain management that are system, nurse, physician, and patient related. An example of system barrier is lack of pain management protocol and limited access to pain specialists unless requested. Other barriers include lack of time and a heavy workload for nurses and physicians, meaning patients may have to wait a certain amount of time to receive their pain medication or for a new medication to be charted. Stigma against pain and concern of addiction can also become a barrier for some patients. One important way to improve pain management in the future is through better communication amongst the multidisciplinary team. For a patient, as successful pain management requires a team effort. For example, better and more accessible communication between the nurse and the pain management team. This helps to ensure all members have the same or similar understanding, helping to develop a more elaborate pain management plan. Another important factor to improving pain management is education. Both the patient and their family members should be educated on effective ways to communicate pain, how to minimize further discomfort, and the possible pain management options available. Patients and family members should also be educated on specific management processes, such as PCAs, to ensure they are as effective as possible. Overall, post-operative pain is a large component of care for a post-operative patient. If managed correctly, patients can have a shorter hospital stay, avoid certain post-operative complications, and have an overall greater satisfaction for their time spent in hospital.